You need to know that you're not facing this alone. Now that you're leaving the hospital, it doesn't mean that you're leaving us behind. We'll follow along with you. We'll have visiting nurses see you at home. Our surgeons are on call 24 hours a day. You have my number. You're welcome to call us at any time. WellSpan is more than just a hospital. We want to be part of your recovery process from start to finish. This is a big deal that you've been through, and we don't want you to think that you have to look to the future without any help. Your family is here. We're going to learn these things together so that when you get home, you can recover fully and be better than you were when you came in.
Your recovery from heart surgery does not end when you leave the hospital. There are many things you will need to do on your own once you are discharged. In this video, you will learn what you can expect before leaving the hospital, how to successfully transition back to your home life, and what steps you will need to take to help maintain a healthy and active lifestyle.
Your body is not done healing. It takes time and your participation, and although you are headed home, you need to continue the work that you've started here in the hospital.
During your discharge class, your healthcare team will discuss any discomfort you may have after leaving the hospital, what you can and cannot do over the next few weeks, and when you can resume your normal activities and return to work. During this meeting, you also will be given written discharge instructions specifically designed for you. It includes guidelines about incision care, diet and nutrition, physical activity, and medications. It will also include the information you will need for your follow-up care. Prior to discharge, your healthcare team will discuss medications with you. This includes receiving any new prescriptions and making changes to ones you have been taking. If you have been prescribed Coumadin, a powerful blood thinner, you will be tested to make sure your dosage is at a safe level before leaving the hospital. Although you may feel healthy the day you are discharged, you may grow tired faster than you did before your surgery. Try to relax and close your eyes 30 to 45 minutes before you leave the hospital. Since you will not be permitted to drive for a few weeks, someone will need to pick you up and drive you home. Splint your incision with your bear when placing the safety belt across your chest. It is important not to overdo it when you first arrive home. Your body is still recovering from major surgery. Friends are an important source of support, but you should limit the number of visitors during the first few days until your strength increases. When you first arrive home, certain activities will be temporarily restricted. These restrictions include tub baths, any activities where pressure is placed on your sternum or breastbone. You should treat your sternum like any other broken bone in your body and give it time to heal. Lifting, pulling, tugging, or pushing anything over 5 pounds for 4 weeks. And any activities that could cause you to strain and open up your incision site. This includes raising your arms above your head and opening windows and car doors. Your sternum needs time to heal. Don't lift anything heavier than 5 pounds, including children, groceries, pets, and laundry. Other restrictive activities include heavy housekeeping, climbing stairs without assistance, gardening, lawn work, and certain sports. Traveling in a car should be restricted to less than 1 hour. You may sit in the front seat, but bring a teddy bear and place him between you and the seatbelt to protect your sternum. Be careful getting out of bed. Roll to your side, legs out over edge, then come up slowly from the side lying position. Some of these activities may be restricted for only a week or two. Others may be restricted until you return for your follow-up visit. You should see your family doctor 2 weeks after discharge. Your follow-up meeting with your surgeon should be scheduled for 4 weeks after discharge.
So there are some clear restrictions that we impose on patients when they go home. We ask that they don't do any strenuous activities, no heavy lifting, until their follow-up visit. But we do like them to resume some normal activities after going home, like walking and getting out of the house.
At home, you will be advised to maintain a comfortable level of activity, which you may increase over time. Walking is a must. Your team at WellSpan will provide you with a walking schedule. This can be followed as a minimum, but you are encouraged to walk as often as you like. But please, no uphill climbs and no panting or rapid heart rates. You should be able to have a conversation while walking. No power walks just yet. It's okay to climb stairs with support once or twice a day. You may do light computer work and non-strenuous recreational activities. You may resume sexual activity when you feel comfortable, which is typically a few weeks after discharge.
Be sure to consult your physician before resuming any activity that you feel uncertain about.
A visiting nurse will visit you 3 times a week for the first 2 weeks in your home. Remember to balance your activities with rest. Resting is fine, but keep in mind, too much napping may interrupt your nighttime sleep routine. Continue your controlled coughing and spirometry exercises as often as your healthcare team directs for several weeks following discharge. Use a pillow or your bear to splint your incision when you cough. These exercises help reduce the risk of lung infections.
There is a lot to remember when you're going home from the hospital, and it can be a bit overwhelming trying to remember everything there is to do. Developing a basic outline for the tasks that you need to do each day will help you keep track of everything, and it'll give us the valuable information that we need.
Start by keeping careful records of your activities. It will help you track physical improvements. You are asked to weigh yourself every morning before breakfast. Try to wear the same amount of clothing in order to receive accurate readings. If you notice a rapid weight gain, generally 2 to 5 pounds, within 2 to 3 days, you could be retaining fluid and should contact your healthcare team. You will also be asked to take your temperature each day. You should contact your healthcare team if your temperature rises above 101 degrees. Rapid weight gain and increased temperature are 2 warning signs that require you to call your doctor. Other signs you should look for are pain, tenderness, burning or warmth in your chest, which may spread to your jaw, neck, or arms, and may or may not be accompanied by breathing difficulties, excessive nausea, sweating, or a return of pre-surgery symptoms. Never be afraid to contact your healthcare team, go to the hospital, or dial 911 if you are experiencing any of these symptoms. Upon returning home, it is important to care for your incisions. Clean your incisions with warm water and antibacterial soap. Use soap that rinses away cleanly and leaves no films or oils on your skin. Pat dry before dressing. Do not apply any lotions or powders until your incisions are completely healed. Check daily for signs of infection. Don't be alarmed if you notice minor redness, bruising, numbness, or if you feel soreness or itching. This is normal. You may also find a lump at the top of your chest incision, which will disappear in a few months. Signs of infection include increased swelling around the incision area, tenderness, soreness, and drainage. Remember, if you feel you are developing an infection and your incisions are not healing as they should, call your healthcare team. Try to keep your legs elevated to keep the swelling down. You may find it helpful to place a pillow under your legs when you're sitting in a chair or lying in bed.
Readjusting to everyday life and recovering from cardiac surgery is a big stress on the body and the mind. It can cause feelings of depression, of sadness. It's not unusual to find yourself crying a lot, feeling sorry for yourself, asking why me.
Irritability, anxiety, memory loss, lack of concentration, and unusual dreams. They are all common after surgery.
These emotions will go away. It just takes time.
Your spouse or loved ones may experience feelings of depression as well. They may also feel the need to be overprotective of your well-being. Talk with each other about your feelings. Communication and the support you give one another is very important. If you have family members who are willing to work with you and support you through the surgical period and the post-operative recovery, that will be of tremendous value. Reach out to family members you think may be able to support you and just spend some quality time with them. And be sure to ask about your local support group for heart patients. Following heart surgery, protecting the long-term health of your heart is more important than ever.
People can feel really good and normal, and it's true, no one cures coronary disease, but we can maximize the benefits of coronary surgery with activity and healthy living.
Probably the best thing you can do for yourself is to maintain a healthy lifestyle. The key to doing this is reducing your risk factors that can cause and increase the damage to your heart. These include abnormal cholesterol levels, smoking and secondhand smoke, high blood pressure, an inactive lifestyle, being overweight, diabetes, and stress. If you have not already done so, work with your healthcare team to find out the factors for which you are most at risk. Most risk factors can be controlled by making some lifestyle adjustments. These include increasing your physical activity, making healthier food choices, quitting smoking, and finding ways to reduce stress in your life.
Living a healthy lifestyle can have a number of health benefits, but it's really up to the individual patient to embrace that lifestyle.
Making lifestyle adjustments can be difficult, especially at first. Start slowly, taking each day as it comes. Don't get discouraged by setbacks, and stay committed. Attending cardiac rehabilitation after you have left the hospital can help you develop the skills you will need to properly care for your heart and live a healthy life. It is also a great opportunity to work with and share with others, learning to make similar adjustments. Remember, recovering from heart surgery does not stop when you leave the hospital. There is still a great deal you will need to do in the short term and long term. Recognizing and following the guidelines covered in this video can help you enjoy a healthy, active, and long life.
Having heart surgery is not an isolated event in your world. This is a time for you to really learn and make some changes in your life. We've started the process here. You've been through the surgery. You've done this hard work. Now going forward, take the information we give you and make the changes that you need to make, whether it's lifestyle change, dietary changes, getting out and enjoying life a little bit more. This is an opportunity for you to be better than you were before. We've done the work here. Now it's your turn to be an active participant and get out there and really live the life that you deserve to live. Be healthier, be happier than ever before.